Question 1. A 5-year-old male Labrador retriever is brought into your clinic with a fever, vomiting, and lethargy. On examination, the dog also exhibits signs of dehydration and muscle weakness. Blood work reveals an elevated white blood cell count and liver enzyme levels. Based on the clinical signs and laboratory results, which of the following is the most likely diagnosis? A. Canine parvovirus. B. Leptospirosis. C. Kennel cough. D. Rabies. Answer B. Leptospirosis. Explanation: leptospirosis is a bacterial infection caused by Leptospira species, typically transmitted through contaminated water or urine. It presents with fever, vomiting, lethargy, dehydration, and muscle weakness alongside elevated liver enzymes. The dog's laboratory results support a diagnosis of leptospirosis. Canine parvovirus typically causes gastrointestinal distress with bloody diarrhea and a low blood cell count, not the elevated liver enzymes seen here. Kennel cough, canine infectious respiratory disease complex, mainly involves respiratory signs such as coughing, not the systemic signs observed in this case. Rabies is a neurotropic virus that causes behavioral changes, paralysis, and difficulty swallowing, which was not evident in this dog. Question 2. Mr. Sanchez, a horse owner, brings in his 4-year-old gelding who has developed severe colic. The horse has been rolling on the ground, looking at its abdomen, and is visibly distressed. The horse has not had any recent changes in diet or exercise. You perform an initial examination and notice that the horse's heart rate is elevated, but other vital signs are within normal ranges. Which of the following should be your next course of action? A. Administer intravenous fluids and monitor the horse for 24 hours. B. Perform a nasogastric intubation to relieve any gas or fluid buildup. C. Immediately proceed to surgery to correct the condition. D. Administer pain medications and discharge the horse with instructions for rest. Answer B. Perform a nasogastric intubation to relieve any gas or fluid buildup. Explanation: colic in horses can be caused by a variety of issues such as gas accumulation or impaction. Nasogastric intubation is a diagnostic and therapeutic procedure to relieve gas or fluid buildup in the stomach, which is a common cause of colic. Administering intravenous fluids, option A, is important for colic treatment but is secondary. Addressing the immediate abdominal discomfort through nasogastric intubation. Surgery, option C, may be necessary if the horse shows signs of more severe colic such as persistent pain, or if non-invasive treatments fail, but it should not be the first line of treatment. Administering pain medications and discharging the horse, option D, is not appropriate for a horse with colic, as it could mask pain and delay necessary interventions. Question 3. Scenario: Ms. Thompson, a dog owner, brings in her 8-year-old Chihuahua who has been coughing intermittently for the past few days. The dog has a history of respiratory issues and recently boarded at a kennel. During your examination, you notice a harsh dry cough and mild nasal discharge. There is no fever or lethargy. What is the most likely cause of the dog's symptoms, and how should you proceed with treatment? A. Canine distemper virus. Initiate supportive care and isolation. B. Canine influenza. Prescribe antiviral medications. C. Kennel cough, Bordetella bronchoseptica. Prescribe antibiotics and rest. D. Canine heartworm disease. Recommend heartworm treatment and diagnostics. Answer C. Kennel cough, Bordetella bronchoseptica. Prescribe antibiotics and rest. Explanation: kennel cough, caused primarily by Bordetella bronchoseptica, is highly contagious and often seen in dogs recently exposed to other dogs in confined environments such as kennels. It causes dry, harsh cough, nasal discharge, and mild respiratory symptoms with no systemic signs like fever or lethargy. Canine distemper virus, option A. Viral infection that causes more severe symptoms such as fever, ocular and nasal discharge, and neurological signs, none of which were present in this case. Canine influenza, option B, can cause respiratory symptoms but typically leads to more severe systemic signs like fever and lethargy, which this dog does not exhibit. Canine heartworm disease, option D, primarily affects the heart and lungs and causes coughing and respiratory distress, but the dog has no history of heartworm exposure or related signs. Question 4. The 3-year-old female cat presents with a history of vomiting, weight loss, and increased thirst. On examination, you notice that her coat appears dull and her skin has the slightly yellowish tint. Blood work reveals elevated liver enzymes, hyperglycemia, and increased serum creatinine. What is the most likely diagnosis for this cat's condition? A. Hyperthyroidism. B. Feline diabetes mellitus. C. Feline infectious peritonitis. D. Hepatic lipidosis. Answer B. Feline diabetes mellitus. Explanation: feline diabetes mellitus (DM) is a common condition in cats, especially those that are overweight. It is characterized by increased thirst, weight loss, and elevated blood glucose hypoglycemia. The yellowish skin jaundice could also suggest liver involvement, and the elevated liver enzymes and creatinine might be secondary effects due to DM. Hypothyroidism (option A) would cause loss, increased appetite, and hyperactivity, but not the elevated blood glucose levels seen here. Feline infectious peritonitis (FIP) (option C) is a viral disease that can cause a variety of systemic signs, including fever, weight loss, and jaundice, but it typically presents with a different pattern of laboratory results. Hepatic lipidosis (option D) is a common liver disease in cats, but would typically present with more severe liver-related symptoms without the clear indication of diabetes. Question 5. A 6-month-old mixed breed puppy presents for a routine wellness exam. Upon physical examination, you find that the puppy has an unusual gait and shows signs of pain when the hip area is palpated. X-rays reveal a shallow acetabulum and femoral head subluxation. What is the most likely diagnosis? A. Hip dysplasia. B. Patellar luxation. C. Osteochondritis dissecans. Or C. D. Lecaperd's disease. Answer A. Hip dysplasia. Explanation: hip dysplasia is a common congenital condition in dogs, especially in larger breeds where the hip joint is improperly formed, leading to subluxation or dislocation of the femoral head from the acetabulum. The puppies get abnormalities and pain on palpation, along with the X-ray finding of a shallow acetabulum and femoral head subluxation strongly point to this diagnosis. Patellar luxation (option B) causes a skipping or lameness gait, but it affects the knee joint, not the hip. Osteochondritis dissecans, or D, option C, is a condition in which cartilage fails to properly develop, causing joint pain and inflammation, usually in the shoulder, elbow, or stifle. Lecaperd's disease, option D, causes degeneration of the femoral head in younger dogs, but it would not typically present with shallow acetabulum on X-rays. Question 6 scenario: Dr. Reynolds, a veterinarian, is treating a dog diagnosed with bacterial pyoderma. The dog has a history of allergies and recurrent skin infections. Dr. Reynolds prescribes a 3-week course of antibiotics and a topical antiseptic solution. 2 days later, the dog's owner calls, reporting that the dog is experiencing vomiting and lethargy. What should Dr. Reynolds do next? A. Prescribe an antiemetic and recommend continued use of antibiotics. B. Discontinue the antibiotics and switch to different class. C. Increase the dosage of antibiotics to compensate for the dog's symptoms. D. Instruct the owner to stop both the antibiotics and the antiseptic solution. Answer B. Discontinue the antibiotics and switch to a different class. Explanation: the dog's vomiting and lethargy are likely side effects from the antibiotic therapy. Antibiotics can cause gastrointestinal upset and, in some cases, sensitivity to the specific antibiotic used. In this scenario, the best course of action would be to discontinue the current antibiotic and switch to another class to address the bacterial infection. Prescribing an antiemetic, option A, would address the vomiting but does not address the potential cause, which is the antibiotic. Increasing the dosage of antibiotics, option C, would not solve the problem and could worsen side effects. Stopping both antibiotics and antiseptic solution, option D, would leave the infection untreated, which could lead to further complications. Question 7. A 2-year-old male boxer dog is presented for a routine checkup. On physical examination, to persistent cough, nasal discharge, and bilateral conjunctivitis. The dog has been vaccinated but has recently been in contact with unvaccinated dogs at a local dog park. What is the most likely cause of this dog's symptoms? A. Canine parainfluenza virus. B. Canine distemper virus. C. Bordetella bronchioseptica. D. Canine adenovirus. Answer A. Canine parainfluenza virus. Explanation: canine parainfluenza virus is a major contributor to kennel cough, causing respiratory signs such as cough, nasal discharge, and conjunctivitis. It is highly contagious and can affect dogs that have been in close contact with other dogs, even if they are vaccinated. Canine distemper virus, option B, would present with more systemic signs, such as fever, vomiting, and diarrhea, and is commonly associated with mild respiratory signs. Bordetella bronchioseptica, option C, is another cause of kennel cough, but in this case, the primary cause is more likely to be parainfluenza, which is more common in vaccinated dogs. Canine adenovirus, option D, typically causes more severe systemic illness such as hepatitis and is not as closely associated with a mild persistent cough. Question 8. You are working with a 9-year-old cat with a history of arthritis. The owner reports that the cat has been increasingly reluctant to jump and has started showing signs of pain when climbing stairs. The cat also has a decreased appetite and has been drinking more water. Blood tests show elevated kidney values and the cat's blood pressure is high. What is the most likely diagnosis? A. Chronic kidney disease (CKD) with secondary hypertension. B. Hypothyroidism. C. Feline osteoarthritis. D. Diabetes mellitus. Answer A. Chronic kidney disease (CKD) with secondary hypertension. Explanation: chronic kidney disease (CKD) is common in older cats and can cause a variety of signs, including lethargy, decreased appetite, and increased water intake. Secondary hypertension often accompanies CKD due to impaired renal function, leading to elevated blood pressure. Elevated kidney values and high blood pressure are indicative of this condition. Hypothyroidism, option B, could also cause increased drinking and a decrease in appetite, but would not typically cause elevated kidney values or high blood pressure to the extent seen here. Feline osteoarthritis, option C, could explain the cat's reluctance to jump and climb stairs, but it would not cause kidney issues or hypertension. Diabetes mellitus, option D, causes increased drinking and urination, but it is not typically associated with the kidney abnormalities seen in this case. Question 9. A 4-year-old male Doberman Pinscher is brought in with signs of excessive drooling, difficulty swallowing, and an inability to move its head. On examination, the dog is weak and there is noticeable swelling in the neck region. Radiographs reveal gas accumulation in the neck soft tissues. What is the most likely diagnosis? A. Rabies. B. Tetanus. C. Brachycephalic obstructive airway syndrome. D. Cervical disc disease. Answer B. Tetanus. Explanation: tetanus caused by Clostridium tetani is characterized by muscle rigidity, difficulty swallowing, and a lockjaw appearance due to tetanic contractions of the jaw muscles. The swelling and gas accumulation in the neck soft tissue suggests that the bacteria are producing gas as they grow. Rabies, option A, can cause similar neurological signs, but the gas accumulation in soft tissues is more indicative of tetanus. Brachycephalic obstructive airway syndrome, option C, causes respiratory distress in brachycephalic breeds but does not lead to drooling or neck swelling. Cervical disc disease, option D, can cause neck pain and difficulty moving the head, but it does not produce the signs of infection or gas accumulation seen here. Question 10. A 3-year-old male rabbit presents with a history of decreased appetite, lethargy, and abdominal bloating. On physical examination, you find that the abdomen is distended and painful to palpation. The rabbit has not been eating its usual amount of hay. What is the most likely diagnosis? A. Gastrointestinal stasis. B. Pasteurellosis. C. Rabbit's diarrhea. D. Uterine cancer. Answer A. Gastrointestinal stasis. Explanation: gastrointestinal stasis is a common condition in rabbits where their digestive system slows down, leading to bloating, abdominal pain, and decreased appetite. It is often caused by inadequate fiber intake, such as a reduction in hay consumption. Pasteurellosis, option B, is a bacterial infection that causes respiratory symptoms, not gastrointestinal problems. Rabbit's diarrhea, option C, involves loose stools, not bloating or abdominal pain. Uterine cancer, option D, can cause abdominal distension in female rabbits, but it would typically not cause the acute symptoms seen here. Question 11. A 5-year-old female beagle is presented with a history of intermittent vomiting, lethargy, and weight loss over the past few weeks. On examination, a palpable mass in the abdomen. Blood work reveals mild anemia and an elevated white blood cell count. What is the most likely diagnosis for this dog? A. Gastrointestinal foreign body. B. Intestinal neoplasia. C. Acute gastroenteritis. D. Canine parvovirus infection. Answer B. Intestinal neoplasia. Explanation: intestinal neoplasia is a common cause of gastrointestinal signs such as vomiting, weight loss, and lethargy, particularly in older dogs. The palpable abdominal mass and the blood work findings of mild anemia and elevated white blood cell count support this diagnosis. Gastrointestinal foreign body, option A, could cause vomiting and abdominal discomfort but would not typically be present with them. Changes in blood work like anemia and elevated white blood cells. Acute gastroenteritis, option C, would cause vomiting and diarrhea but is not likely to produce a mass on examination. Canine parvovirus infection, option D, typically affects puppies and causes severe vomiting, diarrhea, and dehydration, not a mass or chronic weight loss. Question 12. Scenario: a 4-year-old cat is brought in for a wellness exam. The owner mentions that the cat has been scratching around the neck and ears, and there are areas of hair loss, especially around the face. On examination, the cat has multiple crusty lesions and alopecia on the ears and face. What is the most likely diagnosis? A. Flea allergy dermatitis. B. Ear mites. C. Feline dermatophytosis ringworm. D. Sarcoptic mange. Answer: C. Feline dermatophytosis ringworm. Explanation: feline dermatophytosis ringworm is a common fungal infection that can cause hair loss, crusty lesions, and alopecia, particularly around the ears and face. Ringworm can spread through direct contact with infected animals or contaminated surfaces. Flea allergy dermatitis, option A, typically causes pruritus and hair loss along the back and base of the tail, but is less commonly seen on the face, ears. Ear mites, option B, cause intense itching and discomfort, but would primarily be localized to the ears and not result in the widespread alopecia seen here. Sarcoptic mange, option D, causes intense itching, but it typically presents with more severe crusting and scabbing and would be less localized to the ears and face in this manner. Question 13. A 7-year-old golden retriever presents with an acute onset of severe limping and pain when the right hind limb is palpated. Radiographs show a lytic lesion in the femur with surrounding bone sclerosis. What is the most likely diagnosis? A. Osteosarcoma. B. Hip dysplasia. C. Luxating patella. D. Cruciate ligament injury. Answer A. Osteosarcoma. Explanation: osteosarcoma is the most common primary bone tumor in dogs, especially in large breeds. The radiographic findings of a lytic lesion in the femur with surrounding sclerosis are classic for this aggressive malignancy. Osteosarcoma typically causes pain and lameness in the affected limb. Hip dysplasia, option B, would cause a gradual onset of lameness but is not typically associated with lytic lesions or sclerosis on radiograph. Luxating patella, option C, usually causes intermittent limping or lameness but would not present with significant bone changes on radiographs. Cruciate ligament injury, option D, causes limping due to instability of knee but would not cause the type of bony changes seen here. Question 14. A 3-year-old male cat is brought in with a history of lethargy, poor appetite, and vomiting. On examination, the cat is febrile and has an enlarged lymph node. Blood work reveals elevated liver enzymes and a low white blood cell count. What is the most likely diagnosis? A. Feline leukemia virus FeL. B. Feline infectious peritonitis FIP. C. Toxoplasmosis. D. Feline immunodeficiency virus FIV. Answer: B. Feline infectious peritonitis FIP. Explanation: feline infectious peritonitis FIP is caused by a mutation of the feline coronavirus and is characterized by fever, poor appetite, weight loss, and sometimes swollen lymph nodes. The elevated liver enzymes and low white blood cell count are common in FIP. Feline leukemia virus FeLV, option A, can cause immunosuppression and lymphoma, but would not typically cause the liver changes and lymphadenopathy seen here. Toxoplasmosis, option C, can cause fever and lymphadenopathy, but usually presents with more specific signs related to the eyes, lungs, or gastrointestinal system. Feline immunodeficiency virus FIV, option D, can cause lethargy and secondary infections, but would not typically present with these specific blood work findings. Question 15. A 10-year-old female Labrador retriever presents with an enlarged abdomen, increased thirst, and urination. The owner notes that the dog has been ravenously eating but is losing weight. Blood work reveals a high blood glucose level and low insulin level. What is the most likely diagnosis? A. Diabetes mellitus. B. Hyperadrenocorticism, Cushing's disease. C. Hypothyroidism. D. Chronic kidney disease. Answer: B. Hyperadrenocorticism, Cushing's disease. Explanation: hyperadrenocorticism or Cushing's disease is characterized by excessive cortisol production, which can lead to symptoms such as increased thirst, urination, ravenous appetite, weight loss, and a distended abdomen, often due to hepatomegaly or fat redistribution. The high blood glucose and low insulin are consistent with this condition. Diabetes mellitus, option A, causes polyphagia, polydipsia, and polyuria, but typically results in elevated blood glucose and low insulin. However, the lack of other diabetic symptoms and the specific findings suggest Cushing's disease. Hypothyroidism, option C, would cause weight gain, lethargy, and hair loss, not weight loss and increased appetite. Chronic kidney disease, option D, typically causes weight loss and increased thirst, but does not result in the same degree of glu abnormality and abdominal distension. Question 16. A 6-year-old male Dachshund presents with back pain, difficulty walking, and a hunched posture. On examination, there is marked pain on palpation of the thoracolumbar spine, and the dog is reluctant to move. Radiographs show intervertebral disc space narrowing and mineralization of the intervertebral disc. What is the most likely diagnosis? A. Canine hip dysplasia. B. Intervertebral disc disease. C. Spinal cord tumor. D. Osteoarthritis. Answer: B. Intervertebral disc disease (IVD). Explanation: intervertebral disc disease (IVD) is the common condition in small, long-bodied dogs like Dachshunds. The symptoms of back pain, difficulty walking, and a hunched posture, along with radiographic findings of disc space narrowing and mineralization, are characteristic of this disease. A canine hip dysplasia, option A, typically causes pain and lameness in the hips, not the spine. Spinal cord, option C, could cause back pain and difficulty walking, but is less likely to cause the specific radiographic changes seen here. Osteoarthritis, option D, would typically affect the joints and cause more chronic pain rather than acute back pain and disc abnormalities. Question 17 scenario. A 2-year-old Siamese cat is brought in with a history of severe coughing, open mouth breathing, and exercise intolerance. On examination, the cat is in respiratory distress, and auscultation reveals wheezing and crackles. Thoracic radiographs show a diffuse pattern of interstitial lung disease. What is the most likely diagnosis? A. Asthma. B. Feline heartworm disease. C. Feline infectious peritonitis. D. Pneumonia. Answer: A. Asthma. Explanation: feline asthma is a common cause of coughing, wheezing, and respiratory distress. In cats, the interstitial lung pattern seen on radiographs is typical of asthma, which causes inflammation and constriction of the airways. Feline heartworm disease, option B, can cause coughing and respiratory distress, but it typically presents with other signs such as lethargy and weight loss, and the radiographic findings are usually more focal. Infectious peritonitis, FIP, option C, could cause respiratory symptoms, but typically presents with fever, weight loss, and abdominal distension, not primarily with respiratory signs. Pneumonia, option D, could cause coughing and respiratory distress, but would more likely show consolidation or focal lung changes on radiographs. Question 18. A 3-year-old female boxer presents with progressive exercise intolerance, fainting episodes, and labored breathing. On examination, there is a low heart rate and muffled heart sounds. Radiographs reveal an enlarged heart and fluid in the thoracic cavity. What is the most likely diagnosis? A. Canine dilated cardiomyopathy (DCM). B. Canine infectious hepatitis. C. Canine parvovirus infection. D. Congestive heart failure (EHF). Answer: D. Congestive heart failure (CHF). Explanation: congestive heart failure (CHF) can result in signs of poor cardiac function such as exercise intolerance, fainting, and labored breathing. The low heart rate and muffled heart sounds, along with the radiographic findings of an enlarged heart and pleural effusion, support this diagnosis. Canine dilated cardiomyopathy (DCM), option A, could cause signs of heart failure, but more common in large dog breeds, and the absence of arrhythmias in this case make DCM less likely. Canine infectious hepatitis, option B, typically causes liver dysfunction and jaundice, not heart failure symptoms. Canine parvovirus infection, option C, causes gastrointestinal signs and can lead to dehydration, but it does not typically cause heart failure or pleural effusion. Question 19. A 1-year-old male Rottweiler presents with severe lameness in the right front limb. On examination, the limb is swollen and there is severe pain with palpation of the shoulder joint. Radiographs show a large radiolucent lesion in the humeral head. What is the most likely diagnosis? A. Elbow dysplasia. B. Panastatis. C. Osteochondritis dissecans (OCD). D. Humeral head necrosis. Answer: D. Humeral head necrosis. Explanation: humeral head necrosis is a condition where there is death of bone tissue, often in the humeral head, which can cause severe lameness and pain on joint manipulation. The radiolucent lesion on radiographs is characteristic of this condition. Elbow dysplasia, option A, typically causes forelimb lameness but involves the elbow joint, not the shoulder. Panastitis, option B, is a condition affecting the long bones of young dogs, causing intermittent lameness and pain, but it does not present with a radiolucent lesion in the humeral head. Osteochondritis dissecans (OCD), option C, can cause joint pain and lameness, but it typically affects the elbow or shoulder and presents as joint cartilage abnormalities, not a radiolucent lesion in the humerus. Question 20. A 7-year-old male Shih Tzu presents with a history of frequent ear infections, head shaking, and scratching at the ears. On examination, the dog has erythema and debris in the ear canal. The tympanic membrane appears normal, and there is no discharge. What is the most likely diagnosis? A. Otitis media. B. Ear mites. C. Otitis externa. D. Allergic dermatitis. Answer: C. Otitis externa. Explanation: otitis externa is the most common cause of ear infections in dogs and is characterized by inflammation of the outer ear canal. The erythema, scratching, and ear debris are typical signs. The absence of discharge or abnormalities in the tympanic membrane suggests it is limited to the external ear canal. Otitis media, option A, affects the middle ear and would typically present with signs such as head tilting, pain. Discharge from the ear. Ear mites, option B, could cause itching and scratching, but they typically lead to more severe crusting and dark, coffee ground-like discharge. Allergic dermatitis, option D, could cause itching and skin irritation, but it does not typically cause the specific signs of ear canal inflammation seen here. Question 21. A 10-year-old female Labrador Retriever presents with a history of weight loss, increased thirst, and frequent urination. On examination, the dog is lethargic, and blood work reveals hypoglycemia and glucosuria. What is the most likely diagnosis? A. Hypothyroidism. B. Canine diabetes mellitus. C. Cushing's disease. D. Chronic kidney disease. Answer: B. Canine diabetes mellitus. Explanation: canine diabetes mellitus is characterized by increased thirst, urination, and weight loss, often accompanied by hypoglycemia and glucosuria on blood work. Hypothyroidism, option A, is rare in dogs and typically causes weight loss, hyperactivity, and tachycardia, but does not cause glucosuria or hypoglycemia. Cushing's disease, option C, causes symptoms like increased thirst, urination, but is usually associated with increased cortisol levels, not hypoglycemia. Chronic kidney disease, option D, can cause increased thirst and urination but does not typically cause hypoglycemia or glucosuria. Question 22 scenario. A 5-year-old male Persian cat is presented with a history of vomiting, lethargy, and loss of appetite. The cat's abdomen is distended and there is pain on palpation. Abdominal radiographs show gas-filled loops of bowel and possible foreign body. What is the most likely diagnosis? A. Feline low urinary tract disease, flood. B. Intestinal obstruction. C. Pancreatitis. D. Feline hepatic lipidosis. Answer: B. Intestinal obstruction. Explanation: an intestinal obstruction, often caused by a foreign body, is the most likely diagnosis in this case. The clinical signs of vomiting, lethargy, loss of appetite, abdominal distension, and radiographic findings of gas-filled loops of bowel are consistent with this condition. Feline low urinary tract disease, flood, option A, typically causes urinary issues and is not associated with gastrointestines. Pancreatitis, option C, can cause vomiting and lethargy but does not typically present with abdominal distension or radiographic evidence of a foreign body. Feline hepatic lipidosis, option D, often causes anorexia, vomiting, and lethargy, but it would not typically cause abdominal distension or a gas-filled bowel. Question 23. A 4-year-old female German Shepherd presents with severe lameness in the left hind limb and difficulty rising. On examination, there is crepitus and joint instability in the left hip. Radiographs reveal hip joint dysplasia with a shallow acetabulum and subluxation of the femoral head. What is the most likely diagnosis? A. Hip osteoarthritis. B. Hip dysplasia. C. Cranial cruciate ligament rupture. D. Luxating patella. Answer: B. Hip dysplasia. Explanation: hip dysplasia is a common condition in large breed dogs like German Shepherds. The radiographic findings of a shallow acetabulum and femoral head subluxation combined with the clinical signs of lameness and joint instability confirm this diagnosis. Hip osteoarthritis, option A, can develop secondary to hip dysplasia but does not explain the initial signs of joint instability and subluxation. Cruciate ligament rupture, option C, typically causes instability and lameness in the knee, not the hip. Luxating patella, option D, affects the knee joint and is not associated with the findings seen here in the hip. Question 24. A 2-year-old male boxer presents with sudden onset of vomiting, diarrhea, and abdominal pain. On examination, the dog has a fever and abdominal tenderness. Blood work reveals an elevated white blood cell count. What is the most likely diagnosis? A. Canine parvovirus infection. B. Acute gastritis. C. Inflammatory bowel disease. D. Canine leptospirosis. Answer: A. Canine parvovirus infection. Explanation: canine parvovirus infection typically presents with vomiting, diarrhea, abdominal pain, and fever and is most common in young dogs. The elevated white blood cell count is indicative of infection, and parvovirus infection causes severe gastrointestinal damage. Acute gastritis, option B, can cause vomiting and abdominal pain, but does not typically present with fever or elevated white cell count. Inflammatory bowel disease, option C, causes chronic gastrointestinal signs, not the acute onset seen here. Canine leptospirosis, option D, could cause similar signs, but usually also presents with liver or kidney involvement, which would be reflected in blood work. Question 25. A 5-year-old male Maine Coon cat presents with a history of coughing and respiratory distress. On auscultation, you hear wheezing and crackles. Thoracic radiographs reveal a diffuse interstitial lung pattern. What is the most likely diagnosis? A. Asthma. B. Pulmonary edema. C. Feline heartworm disease. D. Feline infectious peritonitis FIP. Answer A. Asthma. Explanation. Feline asthma is characterized by coughing, wheezing, and respiratory distress. The diffuse interstitial lung pattern on radiographs and clinical signs support this diagnosis. Pulmonary edema, option B, typically presents with crackles, but would show more specific signs such as fluid in the lung fields and is often associated with heart failure. Feline heartworm disease, option C, can cause respiratory signs, but results in more focal lung changes on radiographs. Feline infectious peritonitis FIP, option D, could cause respiratory distress, but it typically presents with more systemic signs, including fever and abdominal distension, rather than just respiratory findings. Question 26. A 3-year-old female Dachshund presents with a history of excessive drinking, frequent urination, and weight loss despite a normal or increased appetite. Physical examination reveals a distended abdomen. Blood work shows elevated liver enzymes and glucose. What is the most likely diagnosis? A. Hypothyroidism. B. Hepatic lipidosis. C. Diabetes insipidus. D. Cushing's disease. Answer D. Cushing's disease. Explanation. Cushing's disease hyperadrenocorticism is characterized by excessive production of cortisol and often presents with symptoms such as increased thirst, urination, weight loss, and a distended abdomen. Elevated liver enzymes and glucose levels are also common in this condition. Hypothyroidism, option A, is uncommon in dogs, and while it can lead to weight loss and increased appetite, it does not cause the other symptoms seen here. Hepatic lipidosis, option B, usually presents with anorexia, lethargy, and jaundice, not with the increased thirst and urination typical of Cushing's disease. Diabetes insipidus, option C, also polyuria and polydipsia, excessive drinking and urination, but does not typically result in weight loss or elevated liver enzymes. Question 27 scenario. A 7-year-old male beagle is presented with difficulty walking, joint pain, and reluctance to jump or run. On physical examination, the dog has a reduced range of motion in the hips and a noticeable limp in the left rear leg. Radiographs show joint space narrowing and the formation of osteophytes in the hip joint. What is the most likely diagnosis? A. Hip dysplasia. B. Osteoarthritis. C. Ligament tear. D. Panistatis. Answer B. Osteoarthritis. Explanation. Osteoarthritis OA is the most likely diagnosis given the clinical signs of pain, reduced range of motion, and radiographic findings of joint space narrowing and osteophytes, bone spurs. OA is a degenerative disease that occurs in joints due to wear and tear over time, and it's common in older dogs. Hip dysplasia, option A, can lead to osteoarthritis, but the primary issue in hip dysplasia is abnormal joint conformation rather than degenerative changes. Ligament tear, option C, typically causes acute lameness and instability, which does not match the chronic pain and radiographic findings in this case. Panistatis, option D, bone disease affecting growing dogs, often causing lameness in long bones, but it is not typically associated with joint space narrowing or osteophytes. Question 28. A 5-year-old male bulldog presents with facial swelling, fever, and difficulty swallowing. He is also drooling excessively, and his mucous membranes appear pale. On palpation, a mass is felt near the neck, and a biopsy reveals a necrotizing granulomatous lesion. What is the most likely diagnosis? A. Bacterial abscess. B. Fungal infection. C. Canine parvovirus. D. Lymphadenitis. Answer B. Fungal infection. Explanation. The clinical signs of fever, facial swelling, difficulty swallowing, and pale mucous membranes combined with the necrotizing granulomatous lesion seen on biopsy point to a fungal infection. Fungal infections such as blastomycosis or histoplasmosis can cause these symptoms in dogs, especially in certain geographic areas. Bacterial abscess option A could cause swelling and pain but does not typically present. Granulomatous lesions or the systemic signs seen here. Canine parvovirus option C typically affects puppies and causes vomiting, diarrhea, and dehydration, not the localized facial swelling or necrotizing lesions. Lymphadenitis option D is an inflammation of the lymph nodes, but it does not typically present with granulomatous lesions or the systemic signs seen in this case. Question 29. A 3-year-old female Siamese cat presents with a history of coughing, lethargy, and loss of appetite. On examination, the cat is febrile, and auscultation reveals crackles and wheezes. Blood work shows an elevated white blood cell count. Where's the most likely diagnosis? A. Asthma. B. Feline infectious peritonitis. C. Feline upper respiratory infection. D. Pneumonia. Answer: deep pneumonia. Explanation: the combination of coughing, fever, crackles, wheezes, and elevated white blood cell count suggests pneumonia. Pneumonia in cats is often bacterial or viral and can lead to respiratory distress, and it typically shows up on radiographs as patchy lung consolidation. Asthma option A typically presents with coughing and wheezing, but it is not associated with fever or a markedly elevated white blood cell count. Feline infectious peritonitis (FIP) option B generally presents with systemic symptoms including fever and abdominal distension rather than primarily respiratory signs. Feline upper respiratory infection option C usually causes sneezing, nasal discharge, and congestion, but it is less likely to cause crackles and wheezes or the severe clinical signs seen here. Question 30. A 9-year-old male Rottweiler presents with lethargy, decreased appetite, and weight loss. Blood work reveals an elevated BUN and creatinine, and urinalysis shows low specific gravity. Radiographs reveal bilateral renal enlargement. Where's the most likely diagnosis? A. Acute kidney injury. B. Chronic kidney disease. C. Renal calculi. D. Glomerulonephritis. Answer: B. Chronic kidney disease. Explanation: chronic kidney disease (CKD) is the most likely diagnosis given the history of lethargy, weight loss, and the laboratory findings of elevated BUN and creatinine with low urine-specific gravity, indicating impaired kidney function. The bilateral renal enlargement on radiographs is also consistent with CKD. Acute kidney injury option A would present more suddenly with Amordrum, rise in kidney values, and more severe clinical signs. Renal calculi option C can cause urinary obstruction or hematuria, but does not typically present with bilateral renal enlargement or the systemic signs seen here. Glomerulonephritis option D is an immune-mediated condition that affects the kidneys, but it usually presents with proteinuria rather than the general kidney function issues seen here.